politics involved to help the people that we represent. So thank you, Mike, for your work and support. Thank you also to the Michigan Hospital Association, the Michigan State Medical Society, the Michigan Nurses Association, and of course, all the other healthcare workers and my mom who have tirelessly advocated for this legislation. It's very important to note that reducing workplace violence in hospitals in medical settings isn't just about these bills. Our partners in medicine from across the state, like Sparrow, like the University of Michigan Health System, Henry Ford and Corewell, they are making holistic moves to reduce violence overall with using prominent signage, additional security measures, and training employees in de-escalation tactics. With this overall effort, people will think twice before resorting to physical violence. A safer healthcare environment means better outcomes for patients, which is what we all want. Thank you. I now welcome Dr. Pamela Emanuel to the podium.
Thank you, Representative Green. My name is Pamela Emanuel, and I am an emergency medicine physician. I practice here at Sparrow Hospital in Lansing, Michigan. And as a frontline healthcare worker, we see various degrees of violence on a regular basis. Sadly, we normalize the majority of these interactions as a part of the job, and they often go underreported. Within the past 2 months even, I can recall several physical assaults against physicians, nurses, techs, our security staff, the list goes on. I think we can all agree that these events are not a normal part of anyone's job, and nor should it be something that anybody should expect when they go to work today. As these bills are signed today, it is a step to protect our healthcare workers. In the ER and for all medical professionals, support around this important issue is greatly appreciated. I hope this encourages more people to enter the medical field and also promote the longevity in the medical field. Next up we have, thank you so much, and next up we have Ingham County Health Officer, Dr. Shoyinka.
Good morning, everyone. Thank you, Dr. Emanuel. Thank you for all the work that you do. My name is Nikesh Shoyinka. I am the Ingham County Health Department Medical Health Officer. First of all, I want to thank our state legislators and Governor Whitmer. Thank you very much for the dedicated efforts in getting these crucial bills over the finish line. Today, I'm happy to join all of you to underscore the importance of these legislative initiatives that support healthcare workers, but also safeguard our public health, which is why I'm here. These bills are a critical step towards preventing assaults for healthcare workers across the board as they carry out their duties in caring for others. By establishing our protective environment for everyone, this will empower all of us as healthcare workers to prioritize the well-being of the patients that we serve and the communities that we serve too, without the looming fear of harm. In addition, this also provides tools to our healthcare leaders to create and implement the infrastructure within our healthcare systems that fosters the safety and well-being for the invaluable workforce that we have here. Throughout my career as a physician, I've had the privilege of providing direct clinical care in multiple settings, and I know all of you can identify with that. Having worked alongside with a lot of you here, I can attest that the primary goal for any healthcare provider is to make sure that as they walk away from that encounter, their patients have better health than when they walked into their room, right? But to achieve that, we as healthcare workers must feel safe, must be safe, and must be in a state of well-being. Unfortunately, healthcare worker violence gets in the way of that and undermines our ability to provide high-quality healthcare that our patients need. This impacts patient health and subsequently impacts the health of our communities. But these bills that we're talking about today are pivotal in breaking that potential vicious cycle that we are experiencing. As a public health professional and also as a physician, we all know what the pandemic has done. At the health department, my team and I are dedicated to building, rebuilding, enhancing all the public health programs that are critical as we have learned so many lessons from the pandemic. We were definitely impacted, certainly why we're talking about healthcare worker violence today, which is one of those things that we saw as an increase as a result of the pandemic. But we've also learned a lot of lessons. And one of those lessons is one that I want to share with you today, that one of the programs, public health programs that we need to increase, improve on, enhance, is the better integration of our public health systems with our healthcare systems. This will help us to, one, strengthen our public health workforce, of which you all as healthcare workers are a critical part of. This will improve the overall health of our communities, but it will also enhance our capacity, increase our resilience to provide the care, public health care, healthcare services, and of course be able to respond appropriately when we do have public health emergencies. As a result, I am deeply invested in fostering community relations with our healthcare systems. Ensuring health for the safety of our patients and our healthcare workers is paramount to rebuilding these programs that I'm talking about in order for us to address the substantial health issues that we have in our communities and that show up at within our wards and in our emergency rooms. This safety net that we're talking about today will not only attract new healthcare professionals, but will also fortify existing relationships between healthcare workers and the broader community. We cannot learn from each other if we're constantly worried about harassment for simply doing our jobs, and no one deserves to feel that way. I'm excited to continue my work here to ensure that every Ingham County resident has the health care that they deserve. I'm grateful, though, to have partners in state government who share this commitment and are instrumental in achieving these shared goals. Together we can create a healthcare environment that is not only safe for our providers, but also fosters strong connections between healthcare professionals and the communities they serve. Thank you very much. And now I'm going to hand over to Jessica Lennon, a registered nurse here at Sparrow.
Good morning. Thank you all for being here. As she said, I am Jessica Lannon. I am a registered nurse. I've been here at Sparrow for 11 years. I'm currently a leader in our local union here, a member of the board of directors at Michigan Nurses Association, and also have the privilege and honor of serving the state of Michigan nurses as a member of the State Board of Nursing. I want to thank Representative Breen and Representative Mueller for their sponsoring and championing this legislation. I also want to thank Governor Whitmer for being here signing bills into law. Thank you. Nurses and healthcare workers have a tough job. We do. We accept it. What we shouldn't have to accept is putting up with violence against us when we are just trying to care for our community. But it happens day in and day out. Healthcare workers are spit on, hit, kicked, bit, clawed, etc., while we're simply trying to provide care. I could share statistics with you, but what I want to emphasize is the human impact of these crimes, and that's what they are, crimes. These crimes should never be seen as just or just part of our job. While there are countless examples, I'll just give you a few. One caregiver recently was shoved by a visitor. Another nurse was assaulted with swinging fists by a mother who was angry that her son did not want to see her. Personally, I was threatened with a weapon while helping deliver a baby in labor and delivery. A dad pulled out the largest wrench I've ever seen in my life. It was about this big, I guess it's a plumber's wrench, and made it very clear to myself and our team that if the baby did not come out perfect, we would all pay. Too many workers are forced to leave nursing and other healthcare professions because of the dangers we face every day. We are afraid to come to work. Far too many of my colleagues have suffered the long-lasting consequences of these assaults. Assaults against healthcare workers don't get talked about much, but all of us know multiple colleagues who are dealing with long-term injuries. They're also sidelined them from doing their jobs for months and even years at a time. This includes those who suffer from PTSD. and depression after the violence occurs. It's important to support us, and other workers and hospitals must continue to do just that. I am proud of the direction that our hospital's new leadership is taking and working to address the serious problem of violence against healthcare workers. Thank you, Sparrow. And now the legislature has taken an important step towards contributing to the solution. These bills send a clear message that assaults against healthcare workers will be taken seriously. They provide another layer of protection by helping to hold offenders accountable so our workplace can be safer for all of us as well as our patients. It's important to remember that there is no one single solution to workplace violence. This legislation is an important piece of a complex solution. And again, we thank the legislators and the governor for having our backs. We are grateful and we are hopeful. I'd like to hand it over to Governor Whitmer, and again, on behalf of the frontline nurses and other healthcare workers, I want to thank you for your leadership on this.
Thank you. I'm so pleased to be here. I entered the world in this facility and spent quite a bit of time with my father here in October, and I can just tell you, so grateful for the incredible care. And so I'll just start with that. We're very fortunate to have a facility like this right in our capital city. Today I'm signing House Bills 4520 and 4521 to better protect Michigan's healthcare workers while they are on the job. These bills sharpen fines and against those who assault healthcare professionals and medical volunteers who are on the job at the time of the crime. They also require that operators of health facilities post signs describing the enhanced fees under these bills. These bills are the right thing to do, and they will protect public safety in Michigan. It's a shame that we have to take actions like this, but we do, and so we are. 3 years ago, our state faced a once-in-a-generation pandemic. Can someone knock on some wood for me, please? Doctors, nurses, and healthcare workers across our state stepped up to protect our communities and save lives. They've risked increased exposure to COVID-19, but they did their jobs anyway, performing countless acts of generosity, compassion, grace, and of course, care. They comforted families of the dying and nursed patients back to health. They pulled overtime shifts and stretched limited resources to help people. We owe them a debt of gratitude. They busted their butts, and now it's time for us to have their backs. Unfortunately, today, healthcare workers face rising rates of bullying, viciousness, and violence. According to the U.S. Bureau of Labor and Statistics, healthcare workers are 5 times more likely to suffer a workplace violence injury. Press Ganey, a leading medical survey company, reports that 57 nurses are attacked every day in the United States. That's nearly 2 an hour. And it isn't just healthcare. Violence toward workers on the jobs is up in industries. Record numbers of flight attendants are quitting their jobs. Restaurants are putting up signs asking for what was once given, just good behavior. I've spoken to farmers who told me that folks aren't giving them their combine space on the road and instead flipping them the bird and muttering ugly things out the window. I believe that fundamentally, Michiganders are nice people. We care about our friends and families and neighbors, and at our best, we step up for one another when times get tough, and we stand up to bullies. In Michigan, we can set an example for the nation by treating one another with grace and kindness. We can treat all customer-facing workers better, whether they are stocking the shelves at the grocery store or checking your vitals before the doctor sees you. Today's bills will protect healthcare workers and help Michiganders in this industry know that Michigan has their back. They're an affirmation of the best version of Michigan, a safe place where we treat one another with kindness, dignity, and respect that we all deserve. In Michigan, we can work together to build a better and brighter future for our kids and generations to come. Together, I know we are up to this challenge, and today I'm happy to be able to affix my name to these bills and to change the law in Michigan to protect the work that you all do. So thank you, and let's get to it.
Okay, great, yes, do not wander off with these. Secretary of State won't count it unless we turn it in. Here you go, thank you. All right, thanks everybody.
You guys move that way? I know, we do, I You're all good. You're all good.
Let you get settled. Here. That is ankles.
Where at?
We'll have her set up like right over here. So you're
Get.
You
can set up right here. Over here. Test 1 2 3. 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 It's a bad thing. You're supposed to yell at me.